complicated session. There will be 3 or 4 people talking. This is about the emergence of PD-1 immunotherapy and treatment of patients with Keytruda, of whom I am one. We're going to have a bit of an introduction from Arthur Frank about what Keytruda is and how it works and where it fits into things. Then we will have a presentation that was developed by Lou Williams, a patient in Australia who unfortunately couldn't be here and cannot Skype in, so I will present her slides for her. Then we will have Mavis Ny from the UK, who is a patient who is in a clinical trial of Keytruda. Mavis is on with us on Skype and will give her slides. Hopefully all the technology will work, and then I'll give my presentation on my own experience. So Dr. Frank, let's see if I can go to page down. There we are.
Thank you. Yeah, no, that's fine. Actually, I don't have a whole lot to say, only because, first of all, I'm not an oncologist. I don't treat patients, but Keytruda is this new, for some people, wonder drug. It appears to act better in malignancies that have unstable genetic changes. What do we mean by that? One of the things that characterizes cancer is that there are genetic changes. There are some cancers for which it has not proved particularly useful. Interestingly, the ones that it has shown to be of some use, both melanoma and now mesothelioma, actually share some altered genes. And so in terms of its ability to cause a good response in terms of the patients that get it, it is these cancers with unstable genes that it seems to work best with. It often can take a number of months before there is a response. It's not one of these drugs that necessarily will work immediately. You may have to take it for a while. It suffers from one other problem, and that is true for many of the new therapies that we have these days, is that it is extraordinarily expensive. That is a social issue that needs to be dealt with in other ways. Again, at least in a country like the United States, with the amounts of monies that we have, even given the expense, it is something that people who are appropriate to get it ought to get it. So with that, just by way of some very brief background, I'm going to turn it back to Paul to continue the session.
Thank you. Let's see if I can get this to work. So, by the way, before I start this, I have to say I really appreciate the presentations that were made by the doctors. I'm that living statistical anomaly, probably in every way possible I can think of. And so even though Lou and Mavis and I have survived on Keytruda, we know that we are the statistical outliers. And what Dr. Frank said is very interesting too, because I happened this week to pick up a copy of Time magazine, April 4th issue, and the cover story is "Inside the Brutally Selective, Hugely Expensive, Life-Saving Trials of Immunotherapy," and it's all about PD-1 therapy and the conundrum of the fact that it's very difficult to get into these trials. There are very few of them that focus on mesothelioma. They're very selective in terms of the criteria that allow people in. I was turned down for a trial because I'd had 3 chemotherapies instead of 2. And yet there are people who would benefit. So from a social standpoint, if the drug were free, we'd probably be giving it to everybody who could possibly benefit, but we're not. And that's a social issue that needs to be addressed. And it reminds me very much of the advent of AZT during the AIDS epidemic. And so it's something that does need to be addressed. So Lou's father, Lou is in Australia, and I'm sorry she can't, and she's sorry she can't be here, but she's the daughter of a man who died of mesothelioma. Lou herself was diagnosed with peritoneal mesothelioma. I'm not going to read this slide. I'll let you look at the information just in the interest of time. But she was treated in a kind of standard way. She didn't have radiation, but she did have surgical debulking and chemo. She also was diagnosed then with pleural mesothelioma. 6 years later, went through removal of fluid and chemotherapy. In 2012 and 2014, she had more chemotherapy. She actually went through 8 different chemotherapy regimens. In January of 2015, chest abdomen, and pelvis CT showed pleural thickening and nodules, large abdominal mass, and a large volume of ascitic fluid. She was also vomiting blood at that point. January and February, she went through targeted radiation on one tumor. This is very similar, and you'll see in my own history very similar. March of 2015, she went through another CT showing that mass was slightly larger and unchanged ascites. So this was Lou in April of 2015. She was down to 42 kilograms or 92 pounds, very, very frail, wasting away, on oxygen 24/7, on morphine for chronic bone pain, having frequent blood transfusions, as she described it, no quality of life. And that's when she began Keytruda infusions every 3 weeks. By November, so this is April to November, she was back up to 54 kilograms, so she'd gained 27 pounds. She had no pain, no medication, no oxygen. Her blood work was excellent, and you can see how much better she looks in this picture. But then by February, and then in February of this year, there were still no fluid, no tumors. There were some new tumors in both lungs, but she began to have much more severe symptoms, caving in of the chest on exertion, blurred vision, dryness of her face, and so on, craving for water. It turned out that she basically went into diabetic ketoacidosis as a result of everything that was going on. Could have been related to, she thinks, the steroids that she was on heavily for her chemo, and went back down in weight. In March, she was admitted to the hospital. Even though her bloods looked good, she had a CT because of the symptom, and it showed very aggressive tumor growth. Her brain was clear, but they stopped Keytruda, and they have put her back on more chemo. So that's where she is today. These are slides that I had meant to change, sorry. But she basically is saying she's not giving up. She has too much left to do, and she urges people on to keep up with the fight. Let's see. The next one is going to be Mavis. Mavis, are you on there in Skype?
Okay. I live in the UK, in Kent, and I'm 74 years of age. In 1960, I was unknowingly exposed to asbestos. I was only 18 years old and recently married. This exposure from washing my husband's clothes, which were contaminated with asbestos dust from his employment in the Royal Naval Dockyard in Chatham. In 2009, due to serious breathing difficulties and draining 7 litres out of my lung, I was diagnosed with pleural mesothelioma. I could not even say the word. The prognosis was 3 months to live. I was told it's terminal and there is no cure. I could not and would not accept this. I was determined to fight it all the way. I was given a pleurodesis procedure, leaving me with a porthole that required radiotherapy to seal it. Later, after the consultation, I was offered chemotherapy. This consisted of cisplatin and a limiter, and this helped me to remain stable for 15 months. But unfortunately, my cancer showed new growth. My next step was in 2011, I was offered a place on the NGR HTNF trial. It was never made clear if I was given the drug or the placebo, but I was taken off the trial because I had more growth. In 2012, I was given 2 more sessions of cisplatin and a limiter, but because I had now become allergic and had received so much nerve damage that despite some shrinkage, it was decided to end that chemo. 2013, a CT scan now showed growth, approximately 1 inch during the previous 3 months. I was offered a place on the Adams trial, but due to my fast deterioration and the possibilities of receiving a placebo, I considered I did not have time to undergo all the procedures and buy-up requirements. I needed treatment quickly, and at that point it was suggested I may like to try more chemo. This time it was gem carbo. It resulted in a short-term shrinkage, but soon returned to new growth again. By this time, I was desperate and my whole health had deteriorated drastically. Unable to walk, most of my functions were shutting down. I was in a bad place. At that time, due to a chance meeting, I was advised that there may be a place on a trial aimed at mesothelioma at the Royal Marsden. It was the MK3475 Keytruda and a 2-year trial. To date, I have received 48 infusions over the past 22 months. For me, the trial is nearly over. My scan results in November 2015 were that some tumours are no longer detectable. The remainder were reduced to 1 millimetre or less, and those that remain show no evidence of mesothelioma. I have a scan later this month and hope this trend continues. I was aware that this trial had 3 patients on it, and sadly I'm the only survivor. The conversation now is that I am in remission, a wonderful word, and it will take 5 years in this remissive state before we can say I am cured. The side effects have been edema, itchy skin, blood sugars at 2, and constipation. I don't mind. I'm alive. Oh, Raymond, that's something.
Thank you, Mavis. Well done. When I was first diagnosed in 2003, I realized that I'd had symptoms for about 6 years, which was in the form of ascitic fluid building up in my abdomen. And by the time I was diagnosed, I had been walking like a pregnant woman for 2 years, carrying about 30 pounds of fluid. My pants didn't fit, nothing worked. And the oncologist, and it was just sheer chance, absolutely no one recognized the symptoms in Sonoma County. And it was just by chance, because of an echocardiogram, that the technician noticed all this fluid, and that's when my diagnosis began. And I went to my first medical oncologist I was referred to, said, well, you have 6 months. And if you have fluid removed periodically, you can live a while with it. And I realized after talking with him that he had been looking at the same outdated websites that I'd been looking at, and that's what he knew about mesothelioma. So I didn't believe him. I found a new oncologist, and I really appreciated all the medical discussions because, yeah, I've lived that dream. Yes, I went for another opinion. I found a very aggressive, very fine medical oncologist who happened to have trained with Dr. Alexander, so he knew something, and he got with Alexander, and they had a discussion. I ended up being treated I went through several cycles of paracentesis, removing fluid from my abdomen, but then, and then a diagnostic laparoscopy, excuse me, in early of 04, and then finally went to Creighton University to see Dr. Logie there, who did the surgical debulking and the HIPEC treatment with mitomycin C. You can see here they pulled a lot of things out of me, and he spent 10 hours mucking around with an argon cautery, burning off the outside of my diaphragm and my intestines and stomach and so on, and removing various parts of my body, which fortunately I could live without. And I was okay until 2006. Well, it turned out that some fluid had leaked into my abdominal wall during the diagnostic laparoscopy, which didn't follow the protocol when you suspect mesothelioma, and so I ended up with recurrent small nodule tumors in my abdominal muscles. In 06, I went back to Omaha and had them removed. Again in 2012 and 2013. During all of that time, there was just moderate, slow progression of the disease in my abdomen and pelvis, but I had developed this rather large tumor right behind my liver, and it was actually pressing on the inferior vena cava where it passes behind the liver. In 2013, I went through a course of Tarceva, hoping that it might work on these tumors. It didn't, and we stopped those because of side effects. By 2014, I had that retrohepatic tumor had penetrated into my chest through the diaphragm and was growing fingers up along my lungs. 2014, 2015, we did carboplatin and Alimta, did 6 infusions, and with the typical side effects from that, with fatigue and a variety of other things, and decided after the 6th infusion to terminate the carboplatin. February, March of 2015, we continued with the Alimta. I was still continuing to have symptoms. We did a scan in March, an MRI, and showed that the disease was stable. The metastatic disease was stable. I was continuing to have the side effects, but I decided I want a break. I've had enough for a while. Michelle and I had planned a visit to the South Seas. I said to my doctor, look, I'm an experiment. We do scans every 3 months. We'll do one in March. We'll stop. I'll go to the South Seas in April. We'll be back in May, and in June, let's do another scan. That'll be 3 months, and we'll decide what to do. And okay, we're doing an experiment. And I was doing okay until partway through that trip, that travel, I began to lose my appetite. I developed shortness of breath and a lot of fatigue. And so we were climbing through the jungle in some tropical islands, very remote, and I was having more and more trouble getting through it. So we got back. On June 5th, I had an MRI, and it was very disappointing. It showed substantial progression. That retrohepatic tumor was now completely encasing, and as the radiologist said, nearly obliterating that segment of the IVC and extending into the chest. I had nodules in my lungs now, measuring about a couple of centimeters, and a lot of other metastatic lesions around in my chest and in my abdomen. I had one last Alimta infusion, but it just really didn't do much. And by July 10th, I was continuing to, that was another CT, was getting worse. The lungs at that point had what the radiologist called innumerable bilateral metastatic lesions of varying sizes, also pleural lesions and pericardial fluid. By July of 2015, I was feeling enormous pressure in my abdomen and chest from that tumor behind my liver, increasing fatigue. I'd lost my appetite. I had lost weight from 192 pounds down to 167 pounds. I looked like a stick. A lot of difficulty breathing. I really couldn't do much at all except get out of bed. And Michelle and I were making final preparations. Some of you here received my goodbye message because I thought I had weeks to live. But my oncologist, we had been talking about PD-1 therapy as a potential option for a year or more, but it was still experimental. He said, Paul, there's nothing to lose. Let's try it. And I had my first infusion on July 15th. And I had some targeted radiation on that tumor behind the liver to shrink it, just for a palliative effect. My older son decided at that point that he wanted me to perform a wedding of him and his longtime girlfriend, which I did on August 1st. If you look at this picture carefully, you'll see I was much thinner, and that gray pallor that's how I looked, that's not the camera. By August 3rd, I had my second infusion, but by then I could barely breathe. I was running a fever, and it turned out I had pneumonia, and I went in the hospital. So they sent me straight from the infusion clinic. And the culture showed nothing. We think what happened was tumor breakdown in my lungs was so fast that I couldn't get the fluid out. And after a couple of days in the hospital, I started to feel better, not just like I was recovering from pneumonia, which I'd had before, but better. I said to Michelle, something in my body has changed. And I started to feel better. I got my appetite back. I started to put on weight. I started to be able to get up and do chores around the house. It was a complete change. I've had a total of 13 Keytruda infusions to date. I've had, the August CT showed stable disease. Another scan after that showed general improvement in the abdomen and pelvis. The tumors are shrinking. Mixed results in the chest, some shrinkage. A lot of the tumors that were in my lungs are gone. There are some areas where things don't look quite as good, but pretty minor, and could actually still be signs of recovery in the lungs. They're not sure. But I feel good. I have pretty good energy. My blood tests are almost entirely normal. Everything is normal for the first time in over a dozen years. And my weight's back up. Thank you. I do report to Merck. I called up their consumer line, and I said, do you want my data? And they said, sure, we're happy to take your data. I don't think they're that interested in mesothelioma with Keytruda, but they interviewed me for an hour on the phone. I gave them permission to contact my doctors and all, and I called them periodically with how I'm doing. And I'm seeing some fatigue, a little bit of acne that comes and goes, some skin itching, and the weirdest thing is I developed an aversion to red wine. And I told them about this, and the woman laughed, and I said, I live in Sonoma County, this isn't a small thing. And she laughed, she said, it's in the system. Well, I'm happy to report that that's gone away, and I still got some of the others, but they're diminished, and it's like I'm back to living a normal life, and it's astounding. I mean, I tell people it's embarrassing when you say goodbye and then don't leave. But that's where we are. You know, I am that anomaly. It was peritoneal mesothelioma, which is rare to begin with. I lived 6 years before it was even diagnosed. I've gone through, you know, I've had almost all the lesions and tumors that were talked about up here. And my surgeon at the first day, he said to me, the goal is to keep you alive until there are better treatments available. And that happened with both surgery and chemo, and now with Keytruda. So I don't know what to say about the statistics, but I do think it's sensible to think about expanding treatment with Keytruda for people who don't have options. That's where I am.